welcome to year 2020. Medicare has just announced your physician's fee schedule for year 2020. Now, before we go all the way understanding physician fee schedule, I would like to talk about what is physician fee schedule and what is it based on. So PFS, physician fee schedule, is based on actual RVUs. Now you would ask, or some of you would ask, what is an RVU? RVUs are the units, relative value units, which determines the cost of care based on certain factors. One of them is the time and complexity of the care you provide to the Medicare beneficiary. Number two is the cost of your operations, which is called practice expense, PE. And number three is a malpractice insurance, the cost of your malpractice insurance. According to that RVU, then a statute requires to calculate a GPCI, which is Geographic Practice Cost Indices. What that does is that find out what is the cost of living at different places within the country, and the entire geography is divided into certain areas. So based on this formula of conversion factor is based on three things: RVU, GPCI, and on the basis of that they multiply it with a conversion factor. So this year's conversion factor is just a dime or just a nickel over a dime change from 2019 to 2020. Now, why is this modest update from Medicare? This modest update from Medicare is because of two reasons. Medicare is going towards from cost of care model towards the quality of care model. So at one point of time, Medicare is keeping a flat structure to pay to the physicians, but at the second hand, they are also incentivizing those who are keeping a track of the quality of care. And to maintain that, they are incentivizing up to 10% to the physician in this year and even next year who are implementing MIPS and APM. So there are two major updates about it. In 2020, your fee schedule is not changed. It's very little change, so it's going to stay same. The second change is in MIPS, the quality score points, which is going to be for a flat structure, or if you don't want to have penalties, you have to still maintain minimum 45 points. Another change, if you want to have a performance-based acceleration or you want to qualify for an incentive, then you want to have at least 85 points for your MIPS. So these are the two major changes in your 2020 Medicare fee schedule. Medicare also announces at least 1 year in advance what is going to happen in 2021. And one major change or a key takeaway from this change is that the level 1 visits 99201 are going to go away. And I'm going to have the full podcast on that probably in the next one. But in 2021, you would not see many codes. You would see lesser amount of procedure codes. Plus, you would have to focus on quality of care rather than the quantity of the care. So these are the changes coming for Medicare, and I wish you all the best for year 2020. We as a billing company are very excited to serve you. Have a wonderful, happy new year.